Okay, good afternoon. We'll call to order the Burleigh County Human Service Zone Board. It is Tuesday, March 17th at 3 p.m. We have some people who couldn't attend in person, so they are on via phone. So we'll just start by doing roll call of members.
Commissioner Bakken,
Here.
Kelly Berglund, Senator Dever,
Here.
Tracy Famous, Jim Holm,
Here.
Trevor Van Epp,
Here.
and Director Flory.
Here. I do know that Tracy is on by Zoom, so I don't know.
Tracy or Kelly, if you're on, can you try and respond?
She says she has no sound. Oh, okay. You got it.
Ireland, I like it.
Should turn that on for you. It's not.
If we have any of them on. And we could probably go on, we do have a forum to do the minutes.
Okay. For the public, they're working on the audio, so we'll just keep moving. We do have a quorum, so we'll just go on to the third item on the agenda was the approval of the meeting minutes. So that should be in front of the board. That was from your December 16th, 2025 meeting. So if anybody had any comments, questions, concerns, or wanted to make a motion on those minutes.
I would so move.
Second.
Perfect. So we have a motion and a second. I'll just say all in favor, say aye.
Aye.
Any opposed? Okay, motion carries. Next on the agenda is public comment. So we're open for any public comment if anybody wants to comment. Seeing none. We will. Oh, Tracy, can you hear us now?
I can hear you, yes. Can you hear me?
Yep. Kelly, are you online?
Okay.
Are you online too, Kelly?
She didn't make MPO, so. I don't
Okay,
think she's-
nope. Okay. Next on the agenda is the director's report, so I will just kind of go over the programs. We can start with economic assistance. So, over the last quarter, we have continued to work on our outreach with the DOCR. So that is, having our team members go to the state pen and MRCC. They're there about 2 times a month. They average about 12 to 15 residents that they're seeing during each of those visits, and they're helping them with their release planning as far as completing applications for assistance programs. We are also doing outreach at Ministry on the Margins and Dream Center. Those are happening once or twice a month, depending on everybody's capacity, but doing the same type of efforts, bringing the worker to the people to do on-demand interviews and support with applications. We look towards potential outreach through the detention center, but right now we're pretty limited on our capacity. I have had communication with them about that they just would need us there much more frequently due to the people coming in and out. But we, in the meantime, could provide education on completing those applications, but right now we're not doing the outreach. In this unit, they continue to do ongoing efforts to address the backlog in the programs for application. So reminder for this board and the public that although we are for Burleigh County Human Service Zone, we serve constituents statewide and those applying for benefits statewide. So our workers could be touching cases from all over the state. The backlog right now is pretty focused on the SNAP. However, there is backlog in all areas. When I checked last, the SNAP applications are dated back from December 2022, have not yet been authorized. LIHEAP is dating back to December 15th, with child care and TANF dating back to January 2026. Medicaid also falls back into December. We did meet last week as directors and HHS economic assistance leadership to address the current need, as well as just coming up with strategizing on long-term changes to avoid this process happening. This has happened historically, where we continue to, what we feel like, put bandages on the situation. We'll increase overtime. We'll do focus blitzing in certain areas, but then when we get caught up, we go back into backlog. So there was just greater conversation.
Can I make a comment on that?
Yes, please. Yep.
That is something, Senator Dever, I think we really need to talk to the department-wide about. It's really been tough for clients again. It's to the point where we submit something and I'll submit it on time. Let's say my rent is due for a change March 1st. I just got a letter last Monday saying, oh, we finally got to it. We increased it to your case. Well, then I have complaints. Also, you said all programs are backed up. And LIHEAP and some of the stuff, like I just applied for LIHEAP in the Patterson, and I've lived there for 10 years, and they're just finding now that I'm eligible. And we've asked the eligibility workers in the past, and they said, no, we're not eligible. But then Community Options Scott said, yes, we are. So we fill out the application, and we're waiting for weeks, months, however long it takes to hear back, and nothing gets done. It's just very frustrating, and it's affecting 117 residents in that whole building. So and they'll only get 3 months back pay. So the system is very convoluted, it's very complicated, and then sometimes we get accused as clients, oh, we didn't find it, so we have to call the call center, and it's a big mess. So I think there's something broken that needs to be fixed. And I don't know what it is, Chelsea, but it's not just a Burleigh County thing, it's statewide. And that's kind of where I'm leaning to. Thanks.
Mm-hmm.
It's not your issue, it's a state issue. It's very hard for clients to get.
Thank you, Trevor. What you shared has been shared with many zones, specifically more recently louder than ever. So know that we hear you, we understand that. We talked about that at our meetings last week about the impact to the service delivery to clients. You are correct that this isn't just our zone or any zone, it's a statewide processing, it's a statewide issue. And so that was the intent of that meeting last week, was to come up with where did we veer from the good service delivery and the customer service? What was the intent of the economic assistance redesign, and how do we correct what's happening?
Yes, because I hear it from young families, family voices. I hear it from Dakota Center for Independent Living. I hear it all over the city. They say it's very unfriendly to work with. You don't get answers. You have to recall back. And then if you get disconnected, let's say your Wi-Fi is not working, then it just hangs up on you. And it's connected to the computer. So it's just something needs to change. I don't know what. I know what the intent of redesign was, but it's time for change, because we as clients shouldn't have to wait for a response and then if people lose out on their food stamps and say they don't have money, you know, and don't have a little bit of it saved up from the previous month or don't have special accounts, they're screwed. And how is Morton County doing with their stuff? How are they? Have you talked to the director over there at all? Are they having same issues, Morton County?
Yeah, because it is a statewide issue. Like when I give you these numbers for the backlog and how far we're back, these are not specifically Burleigh County residents. These could be anywhere. So
Yeah.
yeah, they're in the same boat we are. Like when I say the SNAP is back to December 2022,
Yep.
or sorry, 22nd of 2025, that could be a resident anywhere in North Dakota, not Burleigh County.
Yeah, that, in my opinion, and I just want to be honest, it's a little frightening, let me tell you, because we have the most vulnerable waiting for things, and you know, it's just frustrating.
No, I appreciate your honesty. Anybody else have any feedback on that? Otherwise, our team was able to meet with the HHS EA leadership on 224, where we had an opportunity to share our concerns with policies and practices, identify barriers, areas needing improvement. So the same type of idea. We met with them back in February, and then we had this meeting as a whole with directors statewide just last week. So I was just going to shed light on the fact that we did have an opportunity to bring frontline workers forward, those who are actually processing the cases and doing the work, to explain, very similar to what Trevor just described, and them advocating for the clients on the other end of the application, as well as the barriers within the system that they're processing the work in. We've had a couple resignations within our economic assistance unit, but with statewide work, we've been able to refill those positions with other zones. So there could be changes then in our org chart where you'll see those positions were transferred to another zone. That helps them meet the demand of their local walk-in traffic. Again, because you're doing statewide work, it isn't such a big deal if I fill the position or if somebody in their Carson office fills the position, because we're still refilling it to do the work. They can just use that as somebody for walk-in, which is really important because a lot of people do come in for in-person support. We have a large enough team in our org chart that we do have walk-in daily intake that they rotate through to make sure we offer that too.
How is that going with the construction at the Provident building though?
That is another great question. The delivery is still the same. Like we still have somebody there daily for intake. I think the biggest issue we have is the parking. We have a very limited parking in the back because of the construction. We're down to, I think, 3 spaces, and depending on how people park, you could be down to 1 or 2 spaces. So that's the biggest issue we see. I know that there's limited parking off street as well, because often the people doing the work are parking off of 5th Street in that parking. So that is the biggest barrier. Otherwise, once you come inside, our service delivery is still the same.
Good, yeah, I could see it a big problem for accessibility if people need in wheelchairs to get parking will be a big one though. 'Cause if you have to park way across, it's a big issue.
Yeah, I think we're just focused on the long game, that after the remodel, there will be better accessibility to the public. So right now, this is uncomfortable and maybe not the best for that, but I think in the long run, it'll be better.
Okay, yeah.
Otherwise, for this team, as Trevor just described, and you could imagine being the worker on the other end of that work, there would be easily what I would say is morale at an all-time low for the people who are doing things that feel out of their control. So what I try to focus on with this team is what is in our control. What do you have local control over? So many elements we can't, like the building remodel, policies, procedures. So I try to keep them focused on what's within their control and keeping the people that we serve at the forefront. Like I described, we ensure the office coverage for the intake to support the walk-ins, but also trying to foster a place of accountability and where people feel supported. So I think for my management team, we're just trying to focus in on what the workforce needs, trying to hear from the workforce again for what is within our control. Going forward, trying to work on maintaining a high level of integrity regarding our mission, vision, and values. Okay, that's all I have for that program. We'll move on to our child welfare unit. We talked about case management. Case management redesign had been happening for about 18 months. This is a process that we were able to have representation from our frontline workforce and management in different work streams throughout that redesign. They went live with their redesign in January. The emphasis of this redesign was on family engagement and case movement, trying to see quicker reunification and lesser levels of intrusion. What happens sometimes is when cases come in, you hit them hard and fast, and then when family engagement starts to slow down, those cases just linger in care. So we're really trying to focus on what the case managers can be doing to engage the families and move towards quicker supports for reunification. With this, there's different expectations placed on them. We are expected to continue with our current workload, so that meant we had to have conversations internally on what, you can't keep putting things on their plate and expecting a better outcome without giving them additional support. So we were able to get approved for 2 additional support, I would call them support positions, that will help shift some of these duties off of case management and allow them to focus on more high functioning parts of their position, such as like the engagement with the family members, whether that be through physically supporting them with their treatment or mental health services or their visits with their children, that kind of stuff. So we did add an additional FTE for administrative support to do some of the clerical duties they would have been doing, as well as our parent aid team to help with some of those daily activities. Prior to go live, our team was already embracing certain pieces of the case management redesign, such as blending our caseloads from in-home to foster care. We had historically been very separated in those programs, but the idea of redesign is if a family is being served in-home and the case needed to move to where we became the custodian, the family wouldn't have a change in case manager. It would just flow fluidly. So we did that. The biggest impact right now is our challenge for our child and family team meetings. We're shifting the focus to family engagement versus what I would call a report out or an update from team members. What is different is that you will often have stakeholders on the meeting, whether this is therapists, foster parents, schools, who provide updates on their role, and it appears like a report out. So we're trying to shift it to where they can give their update, but if the family doesn't view them as supportive in this process of reunification, we ask those team members to exit so that the family can speak more transparently about what is happening. Sometimes that is why families don't engage with us, because they don't want an audience as they're talking about maybe their struggle with their recovery, their mental health, or a relapse. So ideally, they would see these therapists, schools, and foster parents as supports and allow them to stay on. But until they build those relationships, that has been a change in how we conduct those meetings. All right. Also part of redesign was the implementation of an onboarding manual. So that has been something we've been working on a lot the last 3 months. Previously, we had an onboarding manual for new employees in place. We were able to provide that to the redesign team for their reference. So much of what we did is what's in the new issued manual. So there's not a lot of changes, but this resource and tool has been very helpful in onboarding our newest team members. It just provides consistent. What is different is there's consistent benchmarks for dates that they should be doing things. It just helps them have a roadmap for their onboarding. Additionally, we have implemented our targeted case management. We went live in the new year with that, so we're just really working with the team on regular training and review of their notes. So basically, a lot of the work they're doing can be billable through Medicaid. They just have to submit notes on the work that they're doing. So we're just helping them through that process as we submit for billing and reimbursement, working to ensure timely and accurate information is submitted. Next thing we've been working on is an ICWA audit. So this is a third party, which is the Casey family. It's a national agency that helped with our North Dakota's redesign in our safety framework practice model. They have been collaborating with HHS, and our zone specifically was selected because we serve a large population of Native American youth and families. They are reviewing cases where ICWA applies and then identifying barriers in that case movement reunification, as well as strengths for cases that did move. We just want to figure out what worked and what didn't work. And then we're also looking at prevention. With this, our zone is working on the implementation through their that collaboration between that and other work with our ICWA partners of what we call comfort calls. These are calls that will help strengthen the relationship between the foster provider and the parent, again, for that overall idea that the bio family feels the foster parents aren't just fostering their child, but they're fostering the whole family and there for a support. So this is kind of a new concept. We're just still working out internally, but the concept of it is that once a case is assigned to a case manager, they would facilitate a call between the bio parent and the foster parent. And it's just kind of a touch base on, you know, have your child here. What kind of things would you like me to know about caring for them? Giving them an update and just starting to bridge that relationship. Ideally, we wouldn't have to be the guy to facilitate those long-term and they would have that relationship. And we continue to do our engagement with the Keeping the Culture Alive events. We don't host those, we collaborate with Three Rivers, and they're hosted monthly, and they're just an opportunity for foster parents to take children to culturally sensitive events where they have speakers or presenters come in, and it's open to foster parents and the foster children. Our CPS unit is fully staffed with 2 recent new hires. We have been engaging with a CPS response team. This is another zone, has 2 positions that they were approved for to provide response statewide when zones have incidents of being short-staffed for various reasons. And so you can reach out to this team and let them know we're down 2 positions, we have somebody out on some extended leave, and then based on your caseload capacity, they can, what I would say, deploy their workforce to your area to help with some of your cases. So they have been helping other zones, so we have not had the opportunity to have their help yet, but we have requested that assistance. We are averaging about 30 cases a week for assignment to that team of 10 until we get these 2 new hires fully on board. So it's a high level of work as well as the calm time they're getting due to the workload, additional after hours on-call time, and then supporting any youth that happen to be at the office.
So, do you have a lot of youth at the office?
I would tell you during the day, yes, there are times where youth maybe can't be at school or we don't have childcare for them and their struggle, so we can have youth there during the day. We're always on what I will just tell you is we're always on the brink. It always feels like it could happen. There are gaps in the system for certain needs of certain children. I think the biggest ones we struggle with are your children or older kids who struggle with substance use. There's not enough treatment for them during the day, and if they can't go to school or they can't be at their foster parents' home unattended, which for very good reasons that could come up, then they are at our office. Other things would just be gaps in services for when kids come into care and they have developmental needs. There's not enough homes that are knowledgeable or skilled to meet those needs.
Yeah, you'll see that a lot with the CP, cerebral palsy, and the developmental disabled. There's not enough homes or apartments to do the care.
Mm-hmm.
And we just lost support systems, a provider in Bismarck. They merge now, and now HIT's taking their clients over for, yeah.
Thank you, I didn't know that. So what can we control? We continue to focus on timely face-to-face for the victims of our assigned reports. Recently, we reviewed the statewide data for Q4, which was October through December of 2025. Our zone was able to meet 100% timeliness on the cases that were audited. So again, it's just an audit of so many cases that they pulled from us, but that is a huge win for us. Again, I always try to focus on what do we actually have control over, which it's making sure our workers understand getting out. We've gone over before, but the face-to-face requirements to see cases varies based on the allegations of maltreatment. This data is reported statewide as well, and overall compliance for federal guidelines is 95%. The last quarter, North Dakota was at an 83% compliance. So although our team's audit was at 100 statewide, we were hitting at 83%. Other thing for that team is just some upcoming training that they're working on. Next week is our family-based conference in North Dakota, and then next month they have their ICWA conference. So any comments, questions, concerns on that area. Okay. Next thing is other business. We'll move on to that agenda item. Tracy, I just want to make sure you're still on the line.
Yes, I'm still here.
Thank you. And then is there anybody else who joined us remotely if you wanted to introduce yourself?
Hi, Kristen Hasbargen, Director of Zone Operations with the Department of Health and Human Services.
Thank you.
Hi, Chelsea. Alicia Bauman, DHHS Human Resources and HHS Human Resources for the Human Service Zones. Thanks for having me.
Thank you. Okay, so for this section, I did ask Hasbargen and Alicia to join us. So for other business, I will let this board know that effective Monday, March 16th, I did submit my resignation to the county HR. And so I did provide a 30-day notice to them. So my last official day as the director of Burleigh County Human Service Zone would be on April 14th, 2026. So I did ask that they come to just educate the board on what next steps look like for hiring. And so I don't know, Hasbargen, if you just wanted to walk them through that.
Sure, I sure can. Can they see me?
Yes, we can.
Or can you guys see us? Okay,
Yeah.
I can just see Tracy and Alicia. So first of all, just want to say, like, this is both good and bad news, right? I'm sure as the board, you are not happy to be losing Chelsea, and I feel your pain. Chelsea's done a significant job there, and I know Burleigh has appreciated, as well as the department, her leadership. But on a good note, we know where she's going, right? And that she will fill that role incredibly well. So I'm looking forward to her being a peer with me at the department. So I know that's not easy news to take as a board, but so I keep looking at Tracy's square because we went through this before with the last hiring when Chelsea was hired. And I believe it was Tracy and I, and then Commissioner Matthews, right, that was involved
Correct.
with that as well. So
Yes, correct.
yes, okay. So there are some materials that we have developed and sent to your board members that I think will be helpful in kind of walking through this process. But I think just a few things that the board needs to address today. What we would like to know from you as we walk through this process with you is representatives from the board who would be involved in the interviewing of the candidates and selection. Keep in mind that we have equal representation from the Human Service Zone Board as well as HHS. So if you want two, we'll have two. You want three, we'll have three, you know, whatever your board decides on. But just to know that we will be there in person for those interviews. I think that's important for a position as critical as this, and it's nice to all be in the same room when we're doing interviews and such. So certainly I will be a part of that. And then probably my supervisor, Tim Eisinger, at this point would be included in that as well. So that would be one decision. Chelsea, just let me know if there's anything you need to have questions on or interrupt me.
No, I was just going to say I can jump in quick. So I did let the county HR know yesterday they were willing to, if Commissioner Bakken was okay with that as my portfolio holder, they were willing to fill in for those interviews to represent the county position on that. And then I would think if Tracy would represent for the board, and then you, Hasbargen, and Tim, if that's the interview panel. I would also share with this board that both Pam from HR and my new employer were more than willing to allow me to sit in on the interviewing of the replacement. So that's just what I would propose to this board for the hiring panel. But I open to any comments, questions, discussion.
I would be willing if Tracy can't or something. I don't know your schedule there, Tracy, but I would be more than willing to sit in on some of those if you can't.
Tracy, would that work for you if you wanted to represent the board?
I'm sorry, when Trevor speaks, I don't know if his mic's too far away, cuts out, and I wasn't able to hear any of that.
He was just saying that if you weren't able to do it, he'd be willing to help, but if you would be willing to be the representative for the board on that, you can just let us know.
Yeah, I would be willing to be a representative for the board on the hiring process.
Okay, thanks.
Thank you. And Chelsea, did you say Commissioner Steve Bakken? Is that who you said? I'm sorry, it's a little difficult to hear.
Yep, that's what I was talking about. He's here too. I just was letting you guys know that HR was willing to, for the HR function of that and it being their position, they were willing to cover that if Steve's okay with that.
Yeah, and I'm fine with that.
Okay. So then I think the recommendation Hasbargen would be Tracy, County HR, and then your representation for zone directors, and then if you guys would be comfortable with me sitting in on that hiring process, this board.
Yep.
You were there last time.
Deborah's mic's not on. He said I was there last time, so. Yeah. I don't know if you need a motion on that or if you just needed to know, Kristen, what the board would like.
Yeah, I would say as long as we have the two identified from the board, I think that's helpful. We can move forward. Alicia generally has a contact at the local HR. So Chelsea, do you know who that would be? I heard you say Pam.
Yep.
Okay.
Yep.
Okay.
And to be
That
clear,
would make sense.
Pam's not on the board. Did you need two people who are actually on the board? She would just be doing it in lieu of commissioner.
If we need two, I would be willing to do it.
Yep. We need to have two representatives from the board.
Okay. Then I think,
So if Commissioner Bakken serves on your board as well as Tracy, I think that would meet that qualification, and then Pam can help coordinate that.
Man, if Trevor wants to do it, I'm fine with that too, unless,
How much of a time commitment are we, how much of a time commitment, I guess, are we looking? An afternoon, or what are we looking at?
Yeah,
Probably
great
not.
question. I think it depends on how many applicants we get. Generally, when there's been this, we've interviewed probably the top 3 or 4, I would say, again, depending on the number of applicants of qualified applicants that we get. So I would say it's at least a full afternoon. And then, of course, after that first round of interviews, as we did with Chelsea, we had a second round of interviews to really select the top candidate from that pool. So I hope, and there's some additional meetings, of course, just to make sure the screening questions are ready to go and if there's any questions. But that, I think, does that give you a pretty good idea, Trevor?
Yeah, and would they be able to be held here in this room, or is it up at the state office, or?
I think as long as that room would be available, we could sure do it there.
Okay, yeah, that would work better for me if I was gonna do it, because it's hard for me with transportation, so. And Commissioner Bakken, do you think you need to be on it for county, or do you need to bring this to the commission table?
I don't think we need to bring this to the commission table. As
Okay.
the portfolio holder, I'll just make that decision that we're fine. Would Pam still be part of the process then, Chelsea, or just remove her from the process?
I think then, I don't want to overkill an interview panel, right? And if Hasbargen's bringing 2 people and we're bringing 2 people,
Then,
yeah, that's why I was thinking, if Pam can't do it as your designee for the county, then maybe you did want to do it. Otherwise, there's no local voice on the interview panel, is the concern.
And I think we need it to be you, Steve, just
Okay.
because of
Yeah.
I want to make sure, like, all the counties represented for our rural areas too.
Okay. Okay, then Alicia, I think then what I'm hearing, Hasbargen, is I will let, Alicia already knows the point of contact for the county is Pam, but I think what I'm hearing is Commissioner Bakken to represent the local agency, and then Tracy to represent the board, and then you can select from HHS your choice.
Okay,
And me,
that sounds
right?
good.
What,
I'd like to ask a clarifying question.
Yep.
Chelsea, for your role, you would not be a voting member of the interview panel. You are aware of that, correct?
Correct.
Okay.
And me on it as well, correct?
Yeah.
Yeah.
what would the time, what are we looking at for a timetable?
Yeah, I was just going to kind of dive into that, Commissioner Bakken. I sent some really nice guides for you guys. Hopefully they're helpful. We developed them after the last zone director was hired. They really give you a good timeline, both for you as the board, as well as the hiring guide. As your HR representative from HHS, I just take whatever you guys would like me to do and go with it. So we have a posting already written up that I will send to you and Tracy. And then you can review it. You can review the screening questions. And then as soon as I get the all clear from you guys, I will get that position posted out on PeopleSoft, which is where all of the zone positions are posted. Normally we leave it open for anywhere from 10 to 14 days. Again, you guys get to make that decision. And then when the position closes, then you get the top applicants that meet the minimum qualifications. So the timeline's really up to you guys. I would recommend we post it as soon as you're ready. I can get you those posting information details today yet.
And I would recommend a maximum of posting for 30 days. And I will need, if I'm on it, I will need it in large print, just so you guys are aware.
Can that be repeated, Chelsea? I'm sorry.
Yeah, Trevor was just saying if he's going to participate in the interview process, he would need things in large print, and then he just said he didn't recommend posting any longer than 30 days. So I think you're good on that. And just so you know, Alicia, those references you're talking about are right in front of them. We printed them and provided them.
Oh, fantastic.
Yes.
Yep. So make sure you take a peek at those. They are step by step, so none of this process is confusing. I think the other part that we'll need clarification on, if Tracy and Commissioner Bakken are the representatives from the board, if the rest of the board is good with them making the hiring decision, or if you would like that decision to come back to the board. HHS has the overall authority on hiring, but we do want the commission or the representatives from the board, or the board or the representatives from the board to agree with the decision. So it needs to either be the two of you making the decision, or we bring it back to the full board. It's up to you, but you need to make that decision as well.
I think it should come to the full board. Don't you, Steve? I mean,
I'm fine either way. I mean,
yeah.
HHS has the final decision on that. We're just providing one scoring and recommendations at that point. So, but from a operational perspective, do you guys want to see who the candidate is coming back?
What do you think, Senator Deb?
I mean, I think it makes a difference from a timing perspective, but
My concern would be delaying the.
yeah.
Well, the director will be working with the full board, so we don't need to be involved in the decision. But I think there should be some interaction or introduction.
Another thing, with HHS staff, maybe after this, but what is our plan for interim if we don't have somebody hired in the mean?
We'll talk about that next.
Okay.
First, we'll
Okay.
talk about that part next.
Because the best case scenario, we want to have somebody in place for your final day, so.
I don't think that'll happen though,
Yeah.
just with the,
Well, if the choice is as obvious as it was last time, we should be fine.
Yeah, look where that got us. She's leaving.
I know. I think every comment you want to make was, if you're not leaving, we wouldn't have this problem, but.
I would just add, if you're wondering about going back, the two representatives making the decision or taking it back to the full board, oftentimes then that board has just had an emergency meeting, so it doesn't hold up the process. relative to Commissioner Bakken's question. So I guess whatever you decide you want to do is okay with us. We just want you to have that as a decision by the full board so that we can move forward.
I would think, I think an emergency meeting wouldn't be that hard to schedule, but I also trust whoever's on that, whether it's me, or Steve, I trust them as well, whatever you think is necessary.
I think if we have these representatives that
Okay.
we have delegated to go do this, we've entrusted them, they're gonna be working with HSS. I think they can make that decision, and if something would happen to come up to the point where, and who knows what comes up, but I mean, if it needs to be addressed with the rest of the board, then I think we broach that subject, but we're entrusting HSS and whoever we deem to be on this board. They're there to make that decision.
I agree, and if you get it wrong, we'll let you know.
All right.
So the only other question I had then, and it's just for complete transparency here, because we've been bouncing around a little bit, and obviously for anybody listening at home or anything like that, obviously Chelsea will sit on the board as a non-voting member. Tracy will sit on the board. Commissioner Bakken will sit on the board. And then for HSS, is there a set amount of people that will be on the board that they know of right now? Because I'm thinking making a motion on our end as to who is actually sitting on this, and then we can also designate an alternative in case, Commissioner Bakken has something that comes up, family emergency, whatever. So we have it in place that someone can just step up
Can I
and take that
make
position.
a recommendation?
Sure.
I would suggest if HHS would be okay, I would like to see 3 and 3. 3 from HHS and three from the board. Whether we have to do an open meeting notice, I don't really care. It's just I think it's a big position, and I think we need to get it right for our county and the people we serve. So I would like to see 3 and 3.
So then there'd be a total of 7 individuals on the
Yes.
board. Is that what I'm hearing?
Yes,
Okay.
because it's not hard to notice a meeting. I mean, it takes less than 2 minutes to do that.
I think the concern, from a standpoint of scheduling it, it's 7 schedules to coordinate as well as from the person on the other interview. Again, it's
Okay.
it's a little over. So I'll just reiterate what I'm hearing from Jim is, entertaining a motion that it would be Senator Bakken and Tracy, as well as representation from HHS, and then myself as a non-voting participant in the hiring board. And the HHS can figure out if they want 1 or 2 people. or
Yeah,
3.
they can do that, but then the only caveat on our end would be a set alternate. So if we get to a point and it's go time and it's a few days out or a day before, and for whatever reason Tracy can't make it, Commissioner Bakken can't make it because of family emergency, whatever, I don't want it derailed.
No.
And then we've reduced the number, or we have to reschedule to have an alternative interviewer ready to go to step up into that position.
I can do that.
So then Trevor as the alternative.
Okay.
Okay.
Be fine with
Yeah,
that.
and I think one of the things just to tell the interview panel is we need to make sure, I wasn't on the last time, but I think community relations is important. I think talking to the clients is important, and the foster parents are important. We gotta have a good communicator. So I would just encourage the board members to look at that when the time comes, because this is a complex position, Chelsea. It's not easy work,
I appreciate that.
and so.
So Chelsea, can you summarize kind of what was just said? Is really difficult to hear.
Nope, I'm sorry. Can you hear me okay?
Yes, we
Okay.
can hear you.
Okay, so And I don't even know that I want to request a motion because it's going to be a cumbersome one. So I think we could just come to a consensus that what the request is that I would participate as a non-voting member with Bakken and Tracy as the delegates on behalf of the board. And then HHS will designate their representation. And then they would just like Trevor to be on deck as an alternate in case Bakken or Tracy, something comes up and they're not able to. That is the voting or the interview panel that they would like to identify.
Sounds great. Sounds great.
Okay.
And was a decision made to whether or not the two appointed would make the decision, or the entire board would need to approve that decision?
The consensus is a little bit mixed, that they feel like the delegates can make the decision. They've been chosen to do that, so I think if I'm hearing that correctly, we can just land with that.
Okay.
I think the bigger thing that would mean more is if the questions could be floated by the board. That's where Trevor was just chiming in. He wanted to make sure that the questions focused in on community partnership, advocacy, relationships with the stakeholders. So maybe that would be more meaningful, not so much chiming in on the decision, because that decision is made through HHS, but on the front end of making sure the questions that are being asked align with all their various backgrounds. They all do have very valuable but different positions as board members.
Yeah, so I think what I can do, Chelsea, to kind of help with that is when I send the posting and the questions that we use as screening questions, I'll also include the interview questions that we have historically used, and I would be welcome to any changes, any additions or deletions, whatever. This is definitely your hiring process just as much as it is ours, so we want to be supportive of that. And we'll focus in on that. The only part that really has to be consistent across all postings is that minimum qualification. So you'll see that on one of the documents I send you. That can't be changed because it's for all zone directors, but the rest of it can be fluid as long as we're meeting the mark on expectations.
And if you could send out those questions, the interview questions, to the entire board, because
Yes,
I
sir,
would be
yes.
appreciative of their input if they've got any insight that they'd like to see asked as well.
Yes, sir. I was planning to send all of the documents to the whole board just so that everybody's on the same page.
Thank you.
Yep.
Okay.
So when is this?
Okay, so
Officially
once
opening?
we get the
Hold on,
posted,
hold on, you got a question in the
Yeah,
room.
so when is this officially opening and being posted?
So he was asking when it'll be officially posted and open. I think that'll go back to, Alicia said she will send the description to the delegates, which was Tracy and Bakken, and as soon as they say, yep, we're good to go on this, she'll work on getting it posted. So sooner you respond, the better, and then they can get it posted. And then with the timeline of their recommendation was 10 to 14 days to leave it open.
Yep.
Okay.
I think as soon as that is posted and we have a closing date, Alicia starts working with the interview panel to already set aside some times for interviews. So be expecting an email saying, set aside this afternoon or whatever when we can do those in person. So we'll get working on that as well if we have kind of a estimated timeline of when the closing would be and when the applicants would be ready.
Is the
Okay, Chelsea, did you want me to do that or did you want Pam to do that?
You.
Okay,
Thank you.
is
making
the,
sure.
Yep, thank you.
is the alternate allowed to come listen to the interviews or not?
I don't know, I think we might cross some of these details when we get there. I'm gonna be honest, this is probably the hardest conversation I've had to have, where I'm trying not to be the leader in the conversation when it's naturally what I want to do, but it feels like such an awkward place to try to do that. But I think if I'm gonna be there already as a non-voting party, again, I just try to everybody's calendars, and then when you are at the other end of these interviews, it is very intimidating when you have a stacked room. So I want to make sure that, we have the people there to represent the board, but yeah.
Okay.
Chelsea, one more question. Can I list Tayon as our normal contact person for questions?
Yes, please.
Thank you.
Okay, then I think that segues us beautifully into the question that Jim asked about the interim director. So odds of this getting completed by the time I have my final day, hopefully, we can do all those things. I will not be far away, as they alluded to. I am exiting to take a different position, that I am not far removed from the work that they're doing. I am open to ongoing support, mentorship for anybody. This position meant a lot to me. I would like to do a warm handoff as much as I could do that.
Actually, I don't recall accepting your resignation.
Right. Good point.
Yeah, yes. So, but in the interim, because there probably won't be that person here ready to go that first day. If there is, that's great. I will propose, entertaining a motion that, starting April 15th, Tan will serve as the interim director until the hiring of the new permanent director.
I would make that motion.
Second.
Okay. We have a motion and a second. I won't do roll call just because it's a small group here. So all in favor of that?
Aye.
Aye. Okay, any opposed? Okay, perfect. Motion carries. So that will be the plan. She has served as interim director before. She knows the things that need to be covered, as well as what she'll delegate to the program managers for both my economic assistance and child welfare team. So she's got a lot of support with the right people making the right decisions. So I'll leave her.
Chelsea,
Yep.
could I add something? The biggest, obviously hoping there is leadership in place shortly after your departure, but we know how that might not happen, right? Just to impress upon the importance of having Tayon in place so that those the decisions for the youth that you have in custody, that you can make those custodial decisions. Also just want to share with the board that when we've had a director that has left and is still in the area, it is an option for the board to hire them back as kind of an emergency temp. And so then they, Chelsea, if this is something the board wants to do and Chelsea is open to it, could be available to assist with some onboarding, have some check-ins, and be a support for that new director. So when Chelsea was hired last time, there was 2 interim directors, I believe. You had the former director that handled economic assistance, and then another zone director actually assists with child welfare duties. So there's many different ways that can happen, but I just wanted to let the board know that knowing Chelsea's commitment to this agency, I know that will be important to her for to have onboarding and to know that can be an arrangement that's done so that new director has that support and check-ins and eventually that kind of weans off. We just did that in Rough Rider North after that's out in Stark County when that director retired, and actually worked out really, really quite well. I think the new director felt supported and had some nice check-ins, like, I gotta ask her these questions. So just something for the board to consider as well, but we would certainly support that.
I would make that as a motion that we do that.
Second.
Okay, to be clear, got a motion on the table and a second, that the board would, I'm sorry, I'm trying to make sure I capture, that was a lot that said, that the board would like me to provide part-time support to the new director as they onboard via contract?
I guess my question would be is if you're willing and able and wanting and are open to doing that instead of just
Yep.
forcing you into that. I'd like to ask.
Yeah, yep. Yes, I am open. I sorry, Hasbrook, when you're saying it, I'm like, oh, you're saying I would get paid to do something I probably would have done for free. Just because it is very important to me, and I do want to make sure there's transition, there's support. So yes, I am open to doing that. So yeah, that's not a problem for me.
So I agree with what Jim just said, but it almost seems to me that we're acting a little prematurely, depending on who we hire and
Exactly.
how much support we see them needing. So.
Okay.
Yeah, it's just I'm trying to get it done so we don't have to have a special meeting.
Yep.
You know, so that's my,
Well, at this point, we don't know what we don't know,
Yep.
is what it really comes down to. So if you're open to it
Chelsea,
and we need it, then we'll broach that subject.
Alicia?
I was going to say, I think I heard Senator Dever say that there's a possibility it's not needed. Please know that you don't have to make that decision today. If we need to bring Chelsea back even after the fact, like after she's already started at HHS, that's absolutely something we can talk to you guys about and make sure that process occurs.
Okay. I mean, I still have a motion, so I feel uncomfortable. What would you guys like to do with your motion? Just, you still want to make that motion, or do you want to circle back, Trevor, and just say, depending on the interview
depending
process?
on, you know, but I think it's something strongly, if they say they need it, we'll have to address it.
Okay,
I'll withdraw my motion.
I'll withdraw my second.
okay. Okay, I feel good with that. You guys know that I'm here. I'm not far. You can all track me down. And I'm always here to support. This was very important to me. It was a very hard decision to leave, so I want to make sure, like I said, I'm leaving it in a good place. For our guests on the line, do you have anything else you think we need to cover?
Not from my perspective. Again, if they have questions, please reach out to Chelsea or I. Know that certainly I'm a part of that orientation as well for a new zone director, but it is nice when that former director is right there in the same community to be able to tap into that resource as well. So.
And when can we look for those, that email?
Tonight, I'm gonna do it right after we're done.
Perfect,
To
thank
make sure
you.
you guys get it right away.
Thank you, Alicia.
Yes.
Any other feedback from the board? I apologize that this maybe caught people off guard. Again, this was not a decision that I made lightly. I put a lot of thought into this. I feel like this is the next best step for me and for what I believe in and the work that I would like to move forward. But if anybody else has any comments, questions, concerns.
Just congratulations and thank you for everything.
Yes, thank you.
It's appreciated.
And just since we're on other business, I will let the zone board know, starting April 1, transit will have more service hours for fixed route for your clients that need to get places, 6 to 10 p.m. Monday through Friday, and 7 to 10 p.m. Saturday, and then Sunday, if they call 24 hours ahead, they can ride the transit from 7:30 to 6. But on Sunday, they have to call 24 hours ahead. Just Sunday, it's open to the general public. So that'll be a nice thing for your riders in case they need a ride, you know. They'll be able to get it during the week if they need to get to work or anywhere. So please push it out.
Okay. For those on the line, Trevor was just providing an update on transit and the fixed route schedules and hours of availability, which is very important to those that are accessing our services here at the office. We actually do see a lot of people who have to kind of sit around and wait for their next ride to come. So thank you, Trevor, for the update and your advocacy for those riders.
Yeah, and I would encourage your office to talk to Deidre Hughes about having your office have new rider guides
Okay.
in your office, because I think that could be a place. And that's another thing I was going to bring to the board too. When the new director gets hired, I think it would be a good thing, if she's not from the community, to get involved with the transit, just so she knows how the riders have to go through that process on the fixed route system. So there's a CTIC, she can come, there's board meetings, so
Okay.
just really want to make sure they know how the clients have to move around the community, because it's not easy.
Okay.
Thank you.
All right. Well, if there is no other business for this board, I will close my final meeting as your director of the Burleigh County Human Service Zone, and we are ending at 4:01. Thanks, guys.